Restoring hope for tomorrow, recovering lives for today. That's the mission of Springwoods Behavioral Health. And we've got Dr. Jacob here and Brooke are here to talk more with us today. Thank you for joining us.
Yeah,
Thank you for having us.
Yeah, absolutely. Tell us about Springwoods Behavioral Health, specifically for the piece for the Center for Women.
Sure. The Center for Women, it's a special place, or at least we think it is, and we do our best to create it as a special place. It's a psychiatric unit dedicated specifically to the mental health needs of women. It's the only place of its kind in the Northwest Arkansas community. We are treating primarily women with depression, anxiety, substance use issues, as well as consequences of trauma. We've created a very quiet, safe, welcoming place in order to really slow down and develop an individualized treatment plan to take care of these ladies' needs. It's run by a multidisciplinary team, including doctors, nurse practitioners, our therapist Brooke, nurses, as well as a pharmacist. And if it's to the ladies' comfort and agreement, we'll also collaborate with their outpatient providers in the community, as well as any concerned family members or loved ones who want to be a part of the care. In addition to the treatment itself, we also offer some case management interventions. A lot of the ladies we're treating are going to require referral to more of a residential mental health services, and we can also assist with placement to transitional living or women's shelters, as well as just getting them plugged into resources in the community that they otherwise wouldn't have access to.
Sure, absolutely. Brooke, let's talk about your role as a therapist there.
Yeah, so I just try first just to make them feel safe. I think we all know that like hospitalizations can be really scary.
Sure.
And I just want them to feel safe and secure. It's my role to learn their story. I want to know the journey that kind of led them to our doors. And learning that kind of helps me tailor their treatment and know their goals and know what they need from us. I also try to set them up for success. I want them to just have that confidence to go back to their life. We set them up with outpatient services, so they will have a therapist appointment, they will have a psychiatrist appointment when they leave us, and we also help with resources. A lot of our women, they need transportation, they need housing, they need to know where the closest AA meeting is, and so that's what I do, and I try to help them just go back to their life.
Sure. And I love what you said about it's my role to kind of learn their stories, to find out what led them to our doors. Because I can imagine as you're seeing people come through those doors, especially if they're new to really talking to somebody, that it can be very hard to open up.
They come to us in their most vulnerable state. And some things they say they've never even verbalized out loud. And it is hard.
Sure.
Yeah. Maybe somebody right now at home is watching and they know someone who is in crisis. What's the best they can do to get some help there at Springwoods?
Sure, and recognizing the crisis is the most important first step. Obviously, if there's any emergency or safety scenario, we tell our patients and families to not hesitate to call 911 or take them to the nearest emergency department for Springwoods purpose. For those who can safely make it to us, we are available 24/7, 365 days a year for no cost walk-in assessments, as well as assessments that can be scheduled ahead of time with our intake department. On conclusion of the assessment, we will get them referred to the appropriate level of care, be it the Center for Women, as well we can also get them plugged into anything in the continuum of care in the outpatient setting. I should probably also mention, aside from the Center for Women, we have a couple of outpatient programs, intensive outpatient programs that run 2 weeks. Where patients can come in from the comfort of their own homes and work on the same goals that they're working on in the inpatient setting. And also tell patients and family members, because of the sensitivity and nature of mental health crisis, if there's someone that they feel more comfortable talking with to start, like say a primary care doctor, family physician, that's a good place to get started as well.
Yeah, absolutely. There's some information for you right there on your screen if you do need to reach out. Earlier in the interview as well, we also just popped up some tips to manage stress during the holidays, because we know that sometimes people are very stressed during the holidays. You're entertaining your family, and we don't know what those family dynamics could be, because it could be tricky. So we'll also have those tips over on our website. Thank you both so much for joining us today. We appreciate it.
Yeah.